record this.
We're stop it. And again, leave that loose because it will fill up with air and we don't want to choke the patient. Now at the foot end, there are 4 red caps that need to be fastened. They'll make sure that the air stays in the unit. And on the foot end also, there are 4 valves. And they're clearly marked. It says valve 1, inflate first. Valve 2, inflate second, 3, third, 4, fourth. You need to do it in that order in order to maintain stability. You want to build it much the same as if you were building a house. You want to build from the foundation first, and then the second, then the third floor. You wouldn't build the third floor and then stick a foundation beneath it. And if you're ready to go, all you do is hold the hose against the valve. It doesn't snap on, clip on, screw on. You just hold it there. It will sound like a blower or a vacuum cleaner. And once it reaches capacity, you'll notice it goes up an octave. It just makes a different noise. Just take the hose and go to the next one, and you don't have to cap it. They're check valves. They'll seal themselves. If you're ready to go, I am. Okay. Start jiggling right about now. Gear change noise. I'd like some of you to come and feel how firm this is.
Very firm. Yeah.
It's rock hard, and the reason is you may have a patient that's coated and you need to do compressions.
Wow.
And if it were mushy, obviously you'd have some sort of problems. I'm going to disconnect the blue. Excuse me. Let's take this up. Do you mind just moving that way just for a second? There's a Teflon skid sheet on the bottom, and as you know, Teflon is non-stick. You fry your eggs. Table is a little higher. We're still going to do it.
Just a little bump, Cheryl.
But you're able to pull it over to the bed or the conference room table. And I'm going to inflate this again. Would you mind taking that? Haven't had any experience of using the mat during your daily tasks, can I show them some of the things you do? Okay. Every hour or so, you're required to go in and check on your patients. You want to make sure they're not developing bed sores. And as we all know, that's from pressure points on the unprotected areas of the body, whether it's the shoulder blade, the coccyx, or whatever. And that's if you've got linens and sheets and whatever that happen to be hitting those spots, you come in and you tug it and you straighten her out. If by chance you had a patient that was 300 and some odd pounds, it's obviously a more difficult task. You'd bend her right leg, push her over this way, pull the sheet that way. You would have whatever you want, by the way, on top of this sheet, on top of this mat. You'd have fitted sheets, flat sheets, chuck pads, whatever it is that you normally use in order to keep your patient comfortable and dry. I'm going to wrinkle this up. Okay. Just she were having a bad night and you walked in, you'd have to obviously try to straighten everything out. If she happened to be on the mat, you'd go to wherever it is, the nurse's station, and get the air supply, plug it in, turn it on. Straighten it up. All the heat is gone. It makes things a heck of a lot easier. The other thing that you could do with the mat is to turn the patient on their side. And what's critical in turning a patient on their side is hose positioning. If I wanted to turn her onto her right side, I'd put the hose in the left. If I wanted to turn her onto her left side, I'd put the hose in the right. And the reason is, the theory is that I want to get more air in one side of the mat than the other, whichever that needs to be. So what I'm going to do, and again, it's a little more difficult using a conference table. I'm going to tuck this on that side, and I have the side rail up, but conference tables don't come with side rails. What I'm going to ask you to do, if you don't mind, I'm going to ask you to turn that on in a second. Once it turns on, I'm going to ask you to turn it off. I'm going to disconnect this. Thank you. I'm surprised you can do that for me. Again, I wish there was a... Would one of you at least put your hand here, because there is no side rail? You could turn that on. And I mean, it just really... You weren't rolling over on your own, correct?
No.
No. So the air just inflated on her left side. She rolls onto her right. Now that she's on her side, you could keep her propped up with pillows, wedges, 2x4s, whatever you have available, and then do whatever it is you need to do in order to complete your task. Then we can put it back. We'll put it back. Oh, I'm sorry, it's the conference table. You can get up now.
Are you done?
I think so.